Dear colleagues, I will speak about real-world data for SMA therapy. It is not a secret to you that recently revolutionary changes took place in the therapy of this disease. And the drugs we have changed the prognosis, changed the outcome, changed the quality of life of those patients who get these drugs. Elena Anatolyevna knows that the first the inclusion of the first drug into the list of essential drugs was heatedly discussed. So whether we should support these patients, how we should do it, in what amount. But thanks to the health care ministry's support, and thanks to you, Dr. Maximkina, the drug was supported by all members of the commission. The drugs can be used in real clinical practice. And in Russia, we have accumulated quite a large experience in treating this disease. For example, speaking about Spinraza that appeared in 2019, so we have already data on 700 patients. And this drug, the last one you have mentioned, has been received by 40 patients. Of course, for 10 minutes, I won't be able to discuss the entire clinical practice, but I would like to discuss the following. When we discuss problems of SMA, we focus on the first type of the disease because it is early beginning, it is quick progression, it is life-threatening state, but SMA can have second or third type. It may onset later. That's why the right to pathogenetical therapy is possessed not only by children, but by teenagers and adults. Adults with CMA, with the later onset of class 3 or 4, they can live for a long time. And their life, if they are treated properly, their life is not different from the average life of the population. Thanks to the pathogenetic therapy that we can apply. So the trials showed that these drugs have improved the quality of life, have preserved the motor function, the movement function, and the ability of patients to perform their social functions. Today, you are quite right, this data of real clinical practice, they are analyzed both in the Russian Federation and in foreign countries. I will start with the review of the foreign data. Our colleagues abroad started to use these drugs earlier, started to use Spinraza much earlier than we did. So, and in real clinical practice, they have seen that the use of pathogenic drugs on adults has every right to exist. It is as well justified for adults as it is justified for infants. So we only have meta-analysis that consolidate the data of the clinical practice of, and one of the first meta-analysis about Nuterersen for SMA for patients with the later onset. So the drug was used for 14 months, and now you see the results. The results are really wonderful. If you look at the 60 minutes walk scale and analyze the results. The growth in adults was 20 meters and in children 19 meters. So the adults responded sometimes even better than the children's population. A very well worked out and analyzed data from Germany. They show that the 6-minute walk test, adults showed the increase of 60 plus 60 meters, in Italy plus 20 meters, in Germany plus 46 meters. So it shows that pathogenetic therapy is good for adults and it allows to get a long-term response and to preserve the motion function. The Russian experience is not probably so well analyzed, it's not so well presented in modern literature, but this experience exists and it should be also consolidated. Look, the annual therapy by Sunir Sen in adults in St. Petersburg. There were 13 patients, they received this drug. And it was demonstrated that its use in adults is very effective. From Stavropol, the data are about children's population, and in any types of SMA, the drug showed its efficiency. If we analyze this data from Stavropol, we will see that the most use was received for SMA type 1, but patients with SMA type 2 and 3 had advantages when receiving this drug. Their quality of life improved significantly. The profile of safety is one more aspect that can be studied in real practice. It seems to me real-world data and this are very valuable, because in clinical trials we cannot cover the large population of patients and cannot identify rare and very rare drug-induced adverse events. And it's difficult to assess the profile of safety in such a small population. But look, real-world data show that there are no adverse events to Spinraza and other drugs of pathogenetic therapy. Summarizing, I would like to say that we witness revolutionary changes in treating SMA. And they are possible through registration of pathogenetic therapy drugs. It is very important to understand that these drugs are to be used not only for the most severe types, they are to be used for all patients with SMA. Because if we look at the adult population, it becomes clear that adults with suffer from SMA not less than kids. They are invalids, they desocialize, and the drugs help them to preserve their functions, and this task can be solved. As to the assessment of effects of this or that pathogenetic therapy, here we can be helped by the results of the trials, by their contemplation, and by their pharmacokinetic assessment. And I support your proposal to make an assessment of real efficacy and safety of drugs for primary PAH. The same trials can be made for pathogenetic therapy of SMIA using real-world data.